Hello, everyone. Thank you for taking the time to attend my scholarly project presentation. My name is Ramon Nava. I'm a DNP candidate at Maryville University. Today, I'll be presenting my quality improvement project titled Addressing Low Treatment Adherence in Mental Health Patients. As a practicing PMHNP with a background in family medicine, I frequently observe patients who missed appointments, who discontinued their medication without consulting their provider, or who prematurely ended treatment without proper advice. While psychoeducation is recognized as an evidence-based intervention, I noticed that it was often delivered inconsistently during routine telehealth medication management visits. This observation led me to ask whether a more structured and individualized approach to psychoeducation could improve treatment adherence. Before I begin, I'd like to briefly outline today's presentation. I'll start by discussing the background and significance of the project, including the clinical problem, the project aim. Next, I'll review the supporting literature and theoretical framework that guided this intervention. I'll then discuss the methods, sample, data analysis, and project results. Finally, I'll discuss the limitations, implications for nursing practice, conclusions found, and I'll finish with a personal reflection on what I learned throughout the Doctor of Nursing Practice program. After the presentation, I'll be happy to answer any questions. I would also like to acknowledge the individuals who supported me throughout this doctoral journey. I want to thank my chair, Dr. Robin Hendricks, my second reader, Dr. Boniface Stegman, and my community member, Skylar Ellis, all for their mentorship, constructive feedback, and encouragement throughout the completion of this project. Their guidance has helped me strengthen both scientific rigor and the practical relevance of this work. Background and significance. Treatment adherence remains one of the greatest challenges in psychiatric care. The overall aim of this project was to determine whether individualized psychoeducation could improve treatment adherence during telehealth psychiatric medication management. The project was guided by the following PCOT question. Among adult psychiatric patients receiving telehealth medication management, does implementation of tailored psychoeducation compared with usual care improve treatment adherence during a 10-week intervention period? Now, approximately 1 in 5 adults experiences a mental health illness each year. Although effective medications are available for many psychiatric disorders, their success depends on patients remaining engaged in treatment. Unfortunately, medication non-adherence contributes to symptom relapse, psychiatric hospitalizations, ED utilization, and decreased quality of life. The common barriers include limited understanding of psychiatric illness, medication side effects, financial concerns, the stigma revolving around mental health treatment, poor insight, and psychosocial stressors. Telehealth has been able to expand this access to psychiatric care, especially for individuals who live in rural and underserved communities. However, maintaining patient engagement through virtual visits still remains challenging. While psychoeducation is strongly supported by literature, I identified a practice gap within my clinical setting because psychoeducation wasn't consistently delivered in a standardized manner during routine medication management visits. This quality improvement project sought to address that gap. Literature review. Before implementation of intervention, I conducted a review of the literature to determine what evidence already existed regarding psychoeducation and treatment adherence. The literature consistently demonstrated that psychoeducation improves medication adherence by helping patients better understand their psychiatric diagnosis or diagnoses and their treatment plan. Several studies also emphasize the importance of shared decision making. Patients who actively participated in treatment decisions tend to demonstrate greater adherence, improved engagement, and increased satisfaction with care. Although recurrent findings involve patient education, structured education reduces medication self discontinuation by addressing misconceptions, discussing the side effects, and reinforcing the importance of continued treatment. The literature also highlighted that telehealth requires intentional communication because providers have fewer opportunities for spontaneous patient education compared with traditional face to face encounters. Overall, the evidence strongly supported individualized psychoeducation as a practical, not only that, but also a low cost intervention that was capable of improving treatment adherence. Theoretical framework. This project was guided by Bandura's social cognitive theory. Social cognitive theory, it proposes that behavior change occurs through the interaction of environmental influences, personal beliefs, and individual behaviors. Within this project, individualized psychoeducation served as the environmental intervention. During each medication management visits, patients received education that was tailored to their psychiatric diagnosis or diagnoses, medication regimen, expected benefits, possible side effects, coping strategies, and treatment goals. The intervention was designed to increase patients' knowledge, improve medication understanding, and strengthen their coping skills. As patients became more knowledgeable, the goal was to increase their self-efficacy or their confidence in their ability to successfully manage their mental health. Improved self-efficacy was expected to strengthen positive outcome expectations, meaning that patients would believe that remaining engaged in treatment would improve their health and their quality of life. Ultimately, these changes were intended to improve treatment adherence by increasing appointment attendance, medication adherence, and continued participation in psychiatric care during visits. Methods and design. This project used a quantitative quality improvement design with the pre and post intervention comparison. The project was conducted within an outpatient telepsych practice in Oregon over a 10-week implementation period. Patients received individualized psychoeducation during routine medication management appointments. The educational content was tailored to each patient's diagnosis or diagnoses, their medications, their barriers to adherence, and treatment goals. This design was selected because it allowed evaluation of practice change within routine clinical care while still comparing treatment adherence before and after implementation of the intervention. Sample. So the project analyzed 817 telehealth medication management encounters that involved adults between the ages of 18 and 70 years old. Of these encounters, 395 occurred during a baseline period, while 422 occurred during the intervention period. The encounters represented routine outpatient psychiatric care and included patients with a variety of psychiatric diagnoses, including bipolar, anxiety, depression, schizophrenia, personality diagnoses like histrionic personality disorder, borderline personality disorder, etc. This also reflects a diversity typically encountered in clinical practice. Data analysis. Treatment adherence was evaluated using 3 measurable indicators: no-show appointments, medication self-discontinuation or self-adjustment, and premature termination or treatment termination. The independent variable was individualized psychoeducation, while the dependent variable was treatment adherence. A one-tailed z-test for the difference of 2 independent proportions or 2 proportions was selected because the goal was to determine whether adherence improved following the implementation of the intervention. Statistical significance was evaluated using an alpha level of 0.05 by comparing adherence rates during the baseline period with those observed after implementation. Results. The intervention resulted in a modest improvement in treatment adherence. Baseline adherence was 81.77%, which increased to 83.41% following implementation of individualized psychoeducation. This represented an overall improvement of 1.64%. Statistical analysis produced a z-score of 0.6182 and a p-value of 0.2682. Because the p-value exceeded the predetermined alpha level, statistical significance was not achieved. However, the findings demonstrated a positive trend toward improved treatment adherence while successfully integrating psychoeducation into routine clinical workflow. This graph shows the results of the project pre and post intervention. The graph, it shows treatment adherence comparison between baseline and the intervention, a statistical analysis breakdown, combined adherence outcomes. Also, it stresses the key takeaway that although clinical significance was not achieved, there was still a positive trend. Limitations. Several limitations should be considered when interpreting these findings. First, the 10-week implementation period may have been too short to detect statistically significant behavioral changes. Second, the project included patients with diverse psychiatric diagnoses, which presented unique barriers to treatment adherence. Examples could be some patients who suffered from anxiety were able to be adherent versus other patients experiencing exacerbations in symptoms like schizophrenia or bipolar. Third, psychosocial factors such as financial hardships, family stressors, illness severity, transportation in some cases, social determinants of health could not be controlled. Finally, because the project was conducted within a single outpatient psychiatric practice, generalizability to other healthcare settings may be limited. Discussion. Although statistical significance was not achieved, I believe that the findings did demonstrate a meaningful clinical value. The intervention proved feasible and was successful at being integrated into routine psychiatric medication management without requiring additional staffing or major workflow changes. Standardizing psychoeducation strengthened patient engagement and it reinforced shared decision making throughout the treatment process. The positive trend observed in treatment adherence does support previous literature that suggests that psychoeducation remains an effective strategy in promoting patient participation and also improving patient long-term outcomes. Overall, these findings suggest simple practice changes can positively influence patient care when implemented consistently. Implications for practice. Now, this project has several important implications for not only psychiatric practice, but also maybe in other disciplines. First, Individualized psychoeducation, it does represent a low-cost intervention, and it could be integrated into routine uh, telehealth, even in-person medication management with minimal disruption in clinic flow. Second, consistent psychoeducation has the potential to strengthen patient engagement. It has the potential to improve shared decision making and the potential to encourage treatment adherence. Finally, as a psychiatric mental health nurse practitioner and others alike, we are uniquely positioned to lead evidence based quality improvement initiatives that translate research into sustainable clinical practice. Because this intervention is practical, it's easily replicated, it does have the potential to improve psychiatric care across diverse outpatient settings. Psychoeducation could be applied in every single discipline that's known. In my experience, psychoeducation it was also applied to routine uh, primary care visits, as well as internal medicine settings. Conclusion. In conclusion, this project evaluated whether individualized psychoeducation would improve treatment adherence during telehealth psychiatric medication management. Although statistical significance was not achieved, the intervention it did demonstrate meaningful clinical value by improving patient engagement to some degree while remaining a practical, sustainable, and patient-centered intervention. If I were to repeat this project, I would extend the implementation period, including possibly multiple practice sites, and I'd evaluate additional outcomes like psychiatric hospitalization rates or symptom severity or medication persistence and potentially patient satisfaction. Overall, I think that this project demonstrated that meaningful improvements in psychiatric care do not always require complex interventions. Sometimes, consistently applying simple evidence-based strategies can make a meaningful difference in patients' lives as well as transformation in practice. Personal reflection. Completing the Doctor of Nursing Practice program has transformed the way I practice as a clinician overall. Throughout this journey, I've been able to develop a much stronger understanding of quality improvement, leadership in different aspects, statistical analysis and its importance, implementation science, and evidence-based practice in more ways than one. More importantly, I've learned that successful quality improvement depends not only on selecting an evidence-based intervention, but also on the support found within the organizational culture, the stakeholder engagement, and long-term sustainability. This project, it's reinforced the importance of translating research into practical interventions that improve patient care as well as quality delivered during telehealth or in-person visits. I can continue to practice as a psychiatric mental health nurse practitioner using these skills. By continuing to use these skills, I could hone in and help my evaluation of clinical problems expertise improve. I could also implement evidence-based solutions and promote patient-centered care to the maximum ability in my place. Overall, this experience has strengthened my confidence as both a clinician and as a leader. It's prepared me to continue improving healthcare throughout evidence-based practice or using evidence-based practice and quality improvement. These are the references that informed my project and presentation. Okay, thank you for your time, for your attention, consideration. I sincerely appreciate the opportunity to share my work with you today. I would be happy to answer any questions.